My name is Luis Matos. I am one of the coordinators for the World Organization for the Right of People to Health Care. Today, we are here to talk about a little bit about World Organization and New York State Nurse Association bringing nurses healthcare professionals to Cuba. Today, we have here President of the New York State Nurse Association, Yuri Gonzalez. Then we have Moata Green Littell, and then we have Karim Raymond. She's a nurse. We moderate this workshop today, and I would like to first have a video about one of our delegation to Cuba, and we're gonna have 10-minute video first, and then we're gonna pass to the panelists here who will talk about a little bit about our experience going to Cuba for the last over 25 years. Okay.
Getting good. All right, y'all got to keep going. Let me do it again.
It's almost impossible to describe the way in which all of our lives changed by spending a week in this country.
When I first learned of my opportunity to come to Cuba, I really didn't know what to expect.
I was very excited. It's one of those places that you learn about in school.
It felt as if I had been transported back in time with the old cars rattling down the street, the Yank tanks, as they're affectionately called.
There's so much art and culture and music everywhere you go.
The buildings, the decor, it looks as if everything was frozen in time.
Going somewhere and experiencing it for yourself is just a very different way of actually learning.
It was a learning experience in many levels. It was learning about Cuba's history, about Cuba's healthcare, about their education.
They have a completely unionized workforce, something that I'm still trying to wrap my head around.
It's interesting to see how they organize their regions and how everyone is seen by a doctor. There's no one left out.
They look at healthcare and education and housing and food as basic human rights.
We spent time seeing a lot of things, but we did focus on the healthcare system.
I went everywhere from polyclinics to the medical school to a maternity ward where it's specifically for those who are high risk. I can see what the embargo has done. Some of the clinics have outdated technology or it's not working effectively. But regardless of all this, they have been able to think outside the box.
I was really struck by how thorough and how comprehensive and how full of pride that people are in their healthcare system.
The respect from the provider to the patients, from the patients to the providers, the professionalism of the nurses, the doctors, the healthcare workers, it was just moving.
The emphasis is on primary health, which, they emphasized a lot even with the educators at the nursing school.
And the type of care that people received, the type of attention that people received was extraordinary.
The nurses and the doctors visit their patients in their home.
The partnership that exists between the nurse and doctor to provide a holistic approach to care is mind-blowing.
They seem to have a very humane way of doing their care, which is, I've heard of this, it's very holistic.
I found that there was a lot of kindness and caring about the individual, and that showed through in many ways, including how they deal with their elderly, how they deal with their disabled community, how they deal with child care.
I look at how they treat their children with disabilities with dignity and with pride. You allow them to basically bring out their creativity through art and music.
As a retiree, I am certified Medicare consultant, and the seniors there are freely taken care of by the government. Here, this is open season for Medicare, and you'd be surprised what the seniors are going through.
One of the most moving things that we did was when we went to the Latin American School of Medicine And we saw all these students. You had Africans, Europeans, Americans, black, white, Muslim, Christian, Buddhist. I mean, all these young people that are in there get a free quality medical school education. And the only thing that the Cuban government asks of them is that they leave Cuba and go back to their countries, and they ask them to work in an underserved community.
The things that have stayed with me are the visit to the polyclinic, where we got to see all the different kinds of resources the patients have.
24 hours in terms of polyclinic. They can have immediate access. They have ongoing relationships with their primary provider in the family clinics. So, really you get a sense of there is a lot of trust.
They can come and meet with HIV counselors. They can come get education about their diseases. They can see psychologists. They can see social workers. They have so many resources at their disposal.
The healthcare system for prenatal care, I was utterly amazed. Women in crisis, they are taken care of up until the time of delivery.
They have zero incidents of mother-baby HIV transmission.
They were really trying to educate the populace to stay healthy, and I think that is the direction in which our system here is going.
We're told having safe staffing and having a single-payer system or a system in which everybody gets health care is way too expensive. Well, here you are in a country that spends 1/100th of what we spend per capita on health care, and yet they're able to do that. They have enough staff to take care of the patients get high-quality care, and everybody gets health care.
Cuba pretty much proves that diversity is not an obstacle for single-payer healthcare and free college tuition and taking care of each other.
I think as a primary care doctor in New York or in America, it really helps to see another system.
I'm very grateful for National to give me this privilege of going to Cuba with this delegation.
I thought it was going to be great, but I mean, it far exceeded my expectations.
And this trip has been life-changing for me.
So I just love the fact that I was there to witness it all. It was amazing.
I think that we can continue with our panelists here. I'm going to introduce Judy Gonzalez, who is the president of the New York State Nurse Association that represents over 45,000 nurses around the state of New York. Sister?
This was an amazing project that we engaged with the World Organization of the Right of People to Health Care. Just to give you a little history of our union, this is a union over 100 years old, which pretty much was a kind of a more right-leaning union until our slate, progressive slate, a dissident slate, won election about 5 years ago. And in that process, we had a lot of work to do. We had to transform our union from the grassroots up. Our big call was for a democratic union, a transparent union, and a union that actually represented the interests of the workers and the patients. In that process of transformation, as you're trying to change the whole culture of the organization and use the resources to not only win good contracts, but also to protect our patients, particularly our marginalized and marginalized communities, we had to broaden the perspective of our members who were, just like in many unions, had a very narrow perspective. They saw the union as a kind of benefits provider, some sort of conduit to get their health benefits, as opposed to something that was much bigger than that socially, bigger than that culturally, bigger than that politically. And within that process, our first step was getting people to take control of their work lives on their units, fighting for the issues that mattered, listening to people. As people began to see that things were very different within the union was much more than a kind of service agency, but in fact that they were part of the union. We tried to expand at least the leadership that was elected at that point, and people elected us based on our on-the-ground work. We said, well, we really have to do a lot of ideological work as well through action. And Louis approached us about wanting to engage with us in these trips, and because one of our tenets was looking at a possibility of a single-payer health system in New York State, we thought this was a great opportunity to give people the ability to see what a different system could look like. So we began these health tours. They were according to the restrictions that were imposed by the U.S. when you go to Cuba, but also with our efforts to want to use the opportunity for education. And what we found was in that expansion of people's consciousness, again, starting from your work-life conditions and your own personal issues to the issues of your patients and communities, to the issues of solidarity with other unions, with broader community, and then looking at these broader struggles, because the union had never taken up issues around social justice to the extent that we felt was important, that we were all, one linked community. So when people went to the country, we brought people to Cuba that had never thought about going or had very big misconceptions. And the transformation of people in the process was phenomenal, not only in their understanding of the Cuban healthcare system, but in our functioning as a collective body. And this is something that we've noticed. This is our fourth delegation coming up. People begin as individuals. It's very hard for them to work as a group. After 3 or 4 days, the whole concept of what they call in Cuba compañerismo, this kind of sense of solidarity and communal caring, took over the group. And the transformation in everybody was extraordinary. We had one nurse that came from an upstate town, which is a military town, and he confided in us that he expected to see people in military fatigues with machine guns in the airport when we got there. That was he from well. So this was his picture, like some kind of movie that he'd seen, and he just asked the most questions. And toward the so when we had to go through Miami. When we went back to Miami, we're all brought our luggage in there. We see him with the Che Guevara T-shirt and a little, revolutionary cap with the star on it. And of course, he got detained. Of course. We said, you can't go back to, your town that way. You're in this military town. You better take off that shirt. Because he had been so changed that he didn't realize that nobody else would be changed where he came from. And that was his job, to sort of be an ambassador. As he said, I'm going to have to be an ambassador. And that was the kind of transformation that we saw. So we had 3 goals. Pretty much one in just generating friendship and understanding of the Cuban social system and through the Cuban health system, and our cultural relations and our social relations with people. Also that people were obligated to come back. And just like the Cuban doctors, the people who were trained at the international school, to come back and get involved with the union and the social struggles within the union, to get involved with the single-payer movement, and to be ambassadors about what's going on in the country. And that was definitely something that we found. We have about 60, 70 people have gone already. We have another about 30 going again. And each time people come back, they're transformed, and then they spread the word. So we see this as a really important thing, because these are people who wouldn't normally go. You won't see too many people like that at this conference, for example. But if we don't reach out to others, we're not going to be able to win this fight. So it's a kind of a grassroots effort at educating people, sharing with people, listening to people, hearing the arguments against what we're trying to do, so we're able to respond to it, and also opening people's hearts and minds to the concept of a different system. With what's going on in this country right now, I think with the Occupy movement, with the Black Lives Matter movement, with the millennials for Bernie, the issue of socialism is not such a dirty word anymore. You can talk about it more freely. And certainly there's a big negative feeling about capitalism. So making all those links, trying to link with people, what's going on in your job, what your boss is doing, who is your boss representing, who are you representing, raising class consciousness among our members who need to understand that concept, because many of us are professionals and sort of see, we're not so bad off. We're in a different place right now. We can, they can identify with their hospital, they can identify with administration. So changing that identity to identify with the working class in a more powerful way. So I think that was basically what we tried to do. We're really successful. We have a lot of people wanting to go now, and we're going to keep doing this. It's been a lot of fun for us, a lot of headaches trying to keep people together, not getting lost, but it's very satisfying, and it's really helped our union to grow and to pull people from all over the state into a situation in which they can really thrive and learn. Thank you. I'm going to pass this around after, because I have only one copy. This is similar to the video.
Yes, Yuri. Thank you. I've been part of the World Organization for the Right People to Healthcare for a long time. I am one of the coordinators, and doing this type of delegation to Cuba is it's not easy. It's a little tough. Especially in the country and where we are right now. And we've been doing this for over 25 years. Okay. In the beginning, when we started to organize this type of delegation to Cuba, we used to challenge the United States, law by traveling to Cuba without permits, right? After 1992, we started to travel with under the what we call generalizing, for professional and healthcare. And right now, like you see the panel this morning, okay, they talk about people can travel to Cuba right now. It's not like before. People can travel to Cuba easily right now. Because a lot of people outside, especially in my community, believe that there is a relation between the United States and Cuba. Our job is to try to bring the truth outside there. And we will continue bringing more people to Cuba. We will continue educating people about the political system in Cuba, and for people to go there and see, the real truth about Cuba. Okay, we don't want to take people to Cuba as a tourist. We want to continue bring people to Cuba as an education. The healthcare system in Cuba, you can compare the healthcare system in Cuba not with the United States, compare it with Latin America or the Caribbean. Okay, you will see the difference. For that reason, we take the position to bring people to Cuba, for people to see themselves the real truth about Cuba, and to see the healthcare system. I will pass the floor right now to my brother Moasta Lestel, member of the World Organization for the People to Healthcare.
Good afternoon, everybody. I want to start with saying, I'm proud. I'm hooked up with Lewis. Like I said, well, first of all, I'm a retired paramedic from the City of New York Fire Department, 26 years. And since I retired, I hooked up with Lewis, like I said, about 7 years ago. And I've been to Cuba numerous of times. And, I've been, my personal thing, which, when we travel, sometimes personally how it affects you. When the minute I got off the plane in Cuba, I felt at home. I say, these are my people. As me as an African-American person to relate to that, because Cuba clearly understands, its African roots along with the Spanish colonizers and its indigenous roots, and is a big part of the culture and how the people are. So that would impress me the most. And then also from, the vision of WRPHC, which is, overall, like Lewis said, we've been doing this for over 25 years. And it's the World Organization for the Right to the People to Healthcare. That means people have a right to healthcare. Healthcare is a human right, and it comes from that premise. And I give kudos to my brother who's been doing this for many years, by himself with the help of trade unions here and there from 1199, which he used to work part of. And I just let you know that, first of all, WRPHC, we're a 501c3, we're a nonprofit organization. And the purpose of forming the organization was to promote trade union international relationships, to organize international conferences and educational forums and workshops, to provide political and material resources to help healthcare trade unions and other health organizations. And what that's basically saying is how we like to expose other trade unions. Like I work with New York State Nurses Association, and other unions who have over the years have went with us. It's about creating that real thing in the real world, like we say, some of us socialists say, hey, workers of the world, we unite. But in a real sense, we're giving people, workers, bringing them together to unite around a human right, which is healthcare. And that's, one of the main premise of, the World Organization for the Right to People to Healthcare. In fact, in 2002 is when the organization became incorporated and became like a 501c3. And at that time, there were conferences organized in 2004. They had a big international healthcare conference in Dominican Republic, where there were representatives from Argentina, Guyana, and Canada. In 2005, they did a humanitarian project in the Dominican Republic, which began to organize, people in the Dominican Republic and other parts of, the Caribbean around healthcare and stuff like that. Like was stated earlier, you can't compare the healthcare in Cuba to the healthcare in America, but you can compare it to other places around the world in South and Central America, and also, in Western Europe itself. In fact, most people, don't know that of all the industrialized countries in the world, and so-called developed countries, we're the only country in the world that doesn't have a so-called single-payer system. And that shows you that, and even some of these other countries that are capitalist-based, but in this country, as we know, capitalism, I think, is going wild, so to speak. So it's kind of, it's the worst part of that. Also, in 2007, there was the 2 delegations in Cuba in July and in November. And a group of professional nurses, this is when we first hooked up with New York State Nurses Association, and also SEIU and a few non-union people were part of that. And like, I think it's so, like, you know, we say it's very important for people in the healthcare field to understand that, because a lot of times, like, you know, even people I've taken from our union over there, like, you know, we looked at, you know, wow, over here, people that's, you know, you're treating the patient. You're not worrying about billing and all this other stuff. Like, you know, on my job, first time when we go into somebody's house, we got to, what's your insurance? What's your Medicaid number? So that takes like 2 or 3 minutes of the interview right there to get that. And like I said, when that is taken out of the equation, it's all about the patient. And that's what us as healthcare providers and healthcare advocates, it's about the patient. It's about, you know, creating that bond with the patient, understand what's wrong with them, make the right decision, you know, transport, et cetera, get them the care they need. And like I said, the World Organization Right to Beat the Healthcare, also in 2003, we were invited to El Salvador to participate in a fact-finding trip related to serious problems affecting the healthcare services after healthcare workers and doctors strike. Also in 2003, at the 39th Congress of the Quebec Canada Healthcare Workers Association Union, we presented a general review of the situation of healthcare delivery in America. So in other words, like WRPSC, we're involved internationally, and that's why we call ourselves the World Organization for that. And it's all about exposing what healthcare is about. And also, like, reason why we're, you know, not only we're friends with Cuba, and that's why we're inviting this conference, but we want to use this as a springboard to push single payer in this country. And there's no reason that it can't happen in this country. Like I said, it's not about taking exactly, because each system has to be designed based on the country you're from. Like Canada's system is a little different than the ones in Europe, you know, and different than the ones in South or Central America. But it's all a system that's all about the patient, and it's not about money-based system. So basically, like I said, this is what the World Organization of Right to Beat Healthcare is about, and we hopefully will go forward to make another change right here. Thank you.
Now we pass the floor to our sister here from the Nurses Association, who will talk about a little bit about her experience going to Cuba.
My name's Corinne Raymond. I'm a registered professional nurse at a hospital in the Bronx. I also serve on the board of directors at our union headquarters, the New York State Nurses Association. So to dovetail onto the history of, a little brief history of the New York State Nurses Association, the revolution that Judy mentioned in the beginning, I was a little bit awkward about joining the revolution. I actually wanted to disassociate from NISNA because they weren't doing what we needed to do, but she encouraged me to stay. She encouraged me to join the revolution, and I did. But out of that revolution, I found that in order for us to engage our nurses, we have to do many, many things. And one of the things that I found was very appealing to our nurses were trips and activities. Don't laugh, it's true. We like trips, we like food, we like activities. So going to Cuba was something that I was very, very interested in. I come from a country, as you can tell by my accent, that has a single payer system. For good or for bad, it is a single payer system that I think the British people will die for. So I'm not understanding why in a highly organized, so to speak, country as America, we don't have a single payer system. I suppose it's the capitalist nature of Americans. So we were able to, I was able to go to this, on this excursion to Cuba. I found that it was a way of extending the worldview of our nurses, politically, socially, and culturally. We were exposed to not only the healthcare system, but the way the Cuban people live, the way they support one another, the way they work together in solidarity for whatever their challenges are. In evaluating the healthcare system, I have to say that I am incredibly proud of their accomplishments. I'm not sure that they would have necessarily done as well if it wasn't for the trade embargo. I think that out of challenges, many great things do occur. They have a multi-dimensional healthcare system that should be applauded. They can get 24-hour care. they have access to any and every speciality. Whether from birth to death, they have health care. Everyone has access to health. That is not the same, it's not true here. I remember being a nursing student and not having the capital to afford health care in America, and was very, very concerned about my ability to actually get through nursing school without becoming ill, so that I could get a union job that provided health care. That is not something that the Cuban people or the British people have to concern themselves with. So for me, it was just very refreshing to experience a culture that has been marginalized by the American ruling government, but has been able to provide, I think, outstanding health care for its people. Their educational system is to be applauded also. A nurse in Cuba studies for 4 years, minimum. A nurse in America, she studies for about 2 to 3, depending on whether she has a diploma or whether she has an advanced degree. They don't have to worry about school loans or whether they're going to eat or buy a textbook. It just is. It's part of their upbringing in Cuba to have healthcare and to have access to education. If they want to go on to specialize in their pursuit of their profession, that's all supported and it's free. Here, we spend on average about $10,000 per person on healthcare, whether you're healthy or not, minimum of $10,000. It's far less in Cuba. I don't know the actual number. I would hate to give an actual number, but it is much less. They have 0 infant mortality. I don't really know where America comes on the infant mortality range, but it's not very high. You know, I think that although the embargo has created a system where their equipment is outdated, they do so much with so little, and they're able to provide the healthcare that we would be proud to provide our patients. They actually do have nurse-to-patient ratios in Cuba. As poor as they are, as marginalized as they've been by the rest of the world, they have nursing ratios, something that we are lobbying our New York State electeds to provide us with. A story. I have a nurse who, I told you that we try to organize our nurses through activities, whether it be educational, whether it be through trips, whether it be through school projects. I have a nurse that I have been trying to, activate for years. And all I get is a grumbling and a mumbling. But I told her about my experiences in Cuba and how enlightened I felt. So she went. She went to Cuba. She took her husband. I cannot get her to stop talking about Cuba and the union now. So in terms of extending the conversation to the choir, this is what our union is doing. We are trying to get nurses involved however they come, whether it be through activities like going to Cuba, whether it be through educational opportunities and writing papers. But this nurse is absolutely 100% an active member in the union now. So when we're talking about extending the choir, these are some of the ways in which we can extend this conversation of healthcare, of single payer, of Cuba to the wider body, the body that we're trying to change minds and open hearts to. Thank you.
Well, you know, we're going to open the floor for people to ask questions. Let me get, go ahead.
Hi, my name is. Explain what exactly is single payer. I'm still not exactly familiar what that term means.
Okay,
And-
sorry.
Oh, no, I was just going to say that I'm just glad to hear in general that the NYS, NA, New York State Nurses Association, has been strengthened as a result of this whole thing. And
But we get attacked too.
okay, yeah, and that's hence my next thing. If you can maybe say a little bit more about how involvement in the union has increased, and what other things workers want to do, and what sort of activities you might be planning around like report backs from your trips to Cuba and things of this nature. How that sort of thing's been going. Thank you.
I'm going to do some of single payer because you're better. So single payer is, I suppose, what you would call healthcare for all. It's similar to the Canadian model, the British model, and other countries in Europe. I think America might be one of the last bastions of the world that doesn't provide healthcare to all of its people. So single payer is a model that we're trying to get enacted in specifically New York, but absolutely across all of America. It would be a model by which there aren't these multiple mega $1 million organizations called insurance companies that run healthcare. They wouldn't be telling you what you can have. It would be the physicians that would be telling you what you need and what you should get, and it would all be paid for. There would be no, well, I've only got $10,000 this month or this year, so I can only get 1, 2, 3 things. It just would be. If you need to go to the doctor for a hangnail, you would go. You wouldn't think about your gangrenous hand 3 months later because you couldn't go. You just would have health care.
Expand on it. So if you think of it like we also call it improved and expanded Medicare for all. So the way Medicare is financed, it's through taxes. We all pay taxes, and you see a little thing for Medicare on your receipt if you work for an organization that deducts taxes. So it would be the same thing, but it would cover everybody, not just people over 65, and there wouldn't be Part B and Part C and Part D, and you wouldn't have to pay for drugs. The paying mechanism for healthcare would come from the government. Now, nationally, getting it nationally at this point would be a big challenge. So there's a big movement within New York State and a few other states to get that legislation passed locally, because the Affordable Care Act does allow for a waiver for states to be able to do that. If Trump Care got passed, that would have been a big challenge. So we're very relieved about that. We did pass through the Assembly last year and the year before, not the Senate. It would be an uphill battle, but like a lot of people don't understand it, so our goal now is to really educate around it. So basically you'd have an insurance card, a health care card. It's not a national health system like in England, which would be better, but it's an incremental step toward it. You'd have a card that you present whenever you wanted care. One of the things, I'm an emergency room nurse, and one of the things that we find, even with Obamacare, with more people getting insurance, people, even though they have insurance under Obamacare, they have to pay so much deductible, they still don't go to the doctor. It's a big weakness of the issue. But what I see are people who are really ill, as Karine was saying, because they don't have the money to pay the co-pays or whatever it is, or even if they don't have insurance, they don't get issues taken care of, and they come half dead. With a single payer system or this Medicare for all, people would have, primary care would be greatly expanded, so people would have access to initial care and initial treatment and preventive care and things like this. It's not a panacea, but it's certainly a step up. And also, in the current system, so much money is spent on negotiating with insurance companies. So much money is spent, or so much time is spent for nurses and doctors. Anybody who's been to a doctor or a hospital in the past 2 years probably says, all I see is the person looking at their computer or their phone. They don't even look at me. I hear people say they didn't even look at me, because all we have to do is enter data to get billing taken care of. It's not about hands-on care anymore. So it would be good for the profession, good for the professionals, good for the patient, and a third of every healthcare dollar is spent negotiating the current system. So you'd have much more money to provide the staff that we need, to provide the care that we need. But there's such a lack of education around it, so one of our things is having these town halls and doing a lot of educational programs around it.
So essentially single payer works like Medicare.
Like Medicare, but better than Medicare. You had a second question about the union. What have we seen?
Yeah, what sort of things that you've been doing as far as your report backs from your trip?
So we have the movie that we've shown. We have this this little thing that we have to make more of. We're going to try to. Somebody gave me the idea to put it on our website. A kind of report we have.
And then we do research-based and evidence-based practice report backs through our journal so when our nurses do write papers, we encourage them to write papers. It's good for their education when they're doing their degrees and such. And we will, I think quarterly this comes out, or as often as possible, we do articles in this journal as well.
Pass these around.
And these go out to the nurses. Every nurse gets a copy so they can see what's going on. And that way they can actually ask their local representatives for the union if they can participate in these activities.
Yeah, and just one quick thing about the reports. If you go to WORPHC Facebook page, if you're on Facebook, all the reports are up on our Facebook page too, from the previous delegations and stuff. So that's important.
Okay, the gentleman here.
I assume like Cuba doesn't really have private practitioners who get single payer payments.
No, it's not single payer there.
Right.
It's a socialist system.
Right. And what about Canada or England? Do they
A little
have?
different. England's different from Canada. Has a more of a single payer. England has a National Health Service, which is it's a better system, but they're all underfunded. And plus, because of the presence of our country and the pharmaceutical industry, it has really created a lot of challenges.
To watch the video just to get an idea of what it would mean to take a trip like this to Cuba is, strike me as very valuable. Like so many other things, this was about the healthcare system, but whether you're talking about education or other things, a lot of this really began before the Cuban Revolution came to power. It was when they were in the mountains, when they were fighting in the revolution, where they created the values. They didn't have medical equipment and all that kind of stuff then, right? But they had this idea that, somebody said it earlier today, whatever we have, we share, and which is it's not charity, it's not like if we have a little extra left over, we'll give it to somebody, or but it's a revolutionary value. It's not something you can just impose on the United States. You know what I mean? Because everything is profit driven here, and so I think fighting for I'm glad you guys are fighting for single payer healthcare and stuff like that. But in Cuba, you start to see something a little bit different. What it means to make a revolution, and then what it means to train a whole generation in the values of that revolution. And so then that affects everything, right? It affects everything. And earlier today, I was talking with some of the presenters, about Cuba's internationalism. It has a role to play in terms of the healthcare, with Cuban doctors going all over the world and things like that. But not just doctors, all kinds of different professions. But it's this ethos, it's this value, right? That what we have, we share, and that's not just within our borders, but that looking at it from the point of view of the world. And so I think that's tremendously important. So it shows something about what human beings are capable of, and it shows what we could do in this country, but it also shows that you need to make a revolution, and that if you just leave the whole system in place and then you try to fix some little piece of it, you're going to come up against the problems of the system, and so the last thing I say about the single payer debate, every single healthcare reform in this country has moved us away from universal government-funded healthcare. And the idea that you're going to build some kind of reform and keep the insurance companies and make sure that they're profitable, you're dead right there, And so, a lot of people hated Obamacare. I know I've had to use it. I hate it. And so they were hoping maybe that Trump would do something because he said, I'll do it better, or it'll be great and everything.
Take away everything.
But the point I'm making is, even though Obamacare was terrible, there were certain little pieces of it that were steps forward. And when they started talking about taking those pieces away, well, then it was a whole other ballgame, And so those kinds of things are important.
Anybody else?
Can I ask Martha and Louis, why you say you shouldn't compare the United States system or Cuba against the United States system? Is it just the access to high-fangled machinery? Because if that's the issue, then I think that's a false premise to accept. One thing that really pisses me off about this debate is about the debate here is that, quote, we have the greatest system, unquote, in which certain people have no access to this greatest system we need to compare, and since they're the ones who have introduced the concept of access only, just like I have access to a Lamborghini, which I can never be able to afford.
That's the analogy, though. That is the analogy.
I think we need to confront that. Cuba does have a better health system than America because it's not just about high-fangled machinery. It's about actual access to see a doctor, a nurse, and to get treated. When we went there, we had access, we saw people with actual access on an ongoing basis to medical care. And so they're the ones who talk about medical care, they will introduce something that gives us actual medical care. We need to confront them on their own basis. It's not just about machinery. It's not just about CT scans and whatnot. It's about seeing a doctor when you need one. And the evidence all over the world, not just in Cuba and China. When you flood the populations with even basic access to medical care, mortality rates go down, infant mortality goes down, and people live longer. America has too much fascination with high-fangled machinery.
No, I just want to say on that, when I say that, not to compare the system, is that, well, one's a socialist system in Cuba, as we all associate with capitalism here. And sometimes, like from my experience, even when going over delegations over there, people who operate in a medical capitalist system here in America, when they go over there and they see another system, it's like the social relationships are different, and people can't seem to get it. Like, why, they talk about all the administrative stuff they got to go over here to get stuff done. Where opposed there is like, it's a hands-on, and there's a doctor in the community to make sure you come to your appointments. So, in other words, we're saying like the social system is different, the economic system is different. So therefore, it's like comparing apple and oranges. I'm definitely not saying that, America's system is better because of the technology. I mean, technology has its place, but at the same time, bottom line, if you're going to have all technology like we have and don't have the good patient care and that type of stuff. So when I'm talking about that, that's what I'm talking about.
I just wanted to, something you said about a revolution or whatever. We have to start with where we are. And one of the things we found when you talk about this sense of caring and this sense of looking at things broader than your own self, that is definitely a big problem in our country. But nurses, because they enter the profession, there's something different. It's kind of like in our DNA. You're sort of this advocate for a very vulnerable population. Now, if you have an experience with a patient who's really suffering, there's so much you can do. I mean, not all nurses are the same, but most nurses will do whatever they can to help that person, regardless of what's going on. And we're trying to tap that within our membership because so many of them have that inside of them. And I think in this society, it squashes that sentiment. But when you go to a country like Cuba, or we try to organize around, say, building solidarity from the private sector to the public sector, or from the upstate to the downstate, or the downstate to the upstate, or to a marginalized community, all those things, we try to tap that thing that made people want to be nurses. And say, wake that up, because people are frustrated. We can't give the care we want. The biggest problem we hear is staffing, patient care. I can't be with my patient. That's because people have that in them, and it's been harmed. So we're offering, it's not overnight revolution, but it's getting people to say, I have something in me that loves humanity, and we try to bring that out through our process. And people talk about culture. It's not just dancing and music and food. It's something else. Culture. And you see that in Cuba. You see the culture of caring. That's a culture. Yeah, and I just think that's really important and we're trying, because who is your population? You work in whatever, this is where we work. Some people feel they're above other people because they're professionals, but they have something else. So we try to tap that something else to get people to be transformed. I just thought it was important to share that.
Okay, you have something else?
I just wanted to say, it's always presented as those of us who argue for the lifting of the embargo as if the only people who will benefit from the lifting of the embargo would be the Cubans, because of course Cuba has nothing to contribute to America. Cuba has a vaccine for lung cancer. When we went there, we met a guy who had an international patent, you might remember his name, I can't remember right now, who had developed a system for grafting coral onto whatever the metal was that they used for hip surgery and that kind of stuff. There's a advanced treatment for diabetes that has stopped
foot ulcers.
foot ulcers and people losing appendages and that kind of stuff. And on and on. Some of which has been reported here, to be honest, particularly on NBC and some of the when Obama was in office to encourage the lifting of the embargo. I think we ought to stress that Cuba has a lot to offer. It has 21 bio research facilities, advanced. I have a particular eye problem, and I was telling my doctor when we were going that I had this particular problem. He mentioned that the doctors that he has met at international conferences from Cuba, he considers them to be excellent. It's not just, we are not the only ones who are going to be giving stuff. They'll give a lot of stuff for us that we can benefit from.
Okay, that's good. I just want to make a comment about, when I said that we should not compare, the healthcare system of Cuba with the United States. I believe that, I'm coming from the Dominican Republic, okay? And I've been traveling to a lot of countries and see how the healthcare system functions, okay? And by going to Cuba, by starting to go to Cuba, I see the healthcare system there, how they function, and compare it with the United States. I don't want to, that means that in another way, that Cuba have a humane healthcare system, They don't create doctor nurses to make money. They created doctor nurses, to save people's life. And I believe this is where I'm coming from. And we as an organization, we continue bringing people to Cuba. We continue bring people to educate people to see how the healthcare system works in Cuba and the society, in the political system. And I believe that we should continue doing the same and promoting more and bring this information outside to the community, because this information cannot stay among ourselves. We have to go to the community. We have to talk to the people in the community. We have to make forum in the community and bring it to all different languages, Spanish, English, because these are the people that we need to educate. We already educate them ourselves, okay? But we need to bring this information outside to the community and promoting, and promoting and keep bringing more people to Cuba. Not bring people as a tourist.
Yeah.
Bring people with a program for people to see the working class organized, okay? Because when you go to Cuba, you don't see the working class people in the street. You only see the working class people in Cuba. You will see a May Day when they're coming outside to celebrate May Day. More than 2 million people coming and May Day outside to celebrate. Those people, you don't see it in the street. These are the people who continue building the Cuban society and organizing day by day to try to improve the working conditions over there. And I believe that, if you don't have any more questions. No.
I want to make one, wait.
Oh, what's your
Hold on. We are having a fundraising event at NICENA headquarters. That's 131 West 33rd Street on April 21st. It's to help finance our trips. Speaking about culture, we have these amazing women DJs who are fantastic. And we're going to have like progressive karaoke. And we're a lot of women, so if you're in an organization with a lot of men, bring the men. Because we always complain that we don't have enough men because there's so many women. But anyway, I have flyers here for you. We have
tickets too.
We have tickets for sale. Advance is cheaper, $20. We're going to have food and drinks. And, you have a great time, meet all these wonderful nurses. So please take some flyers, spread them around, take some of our literature. I didn't want to neglect to mention that.
There's actually a pull-out in the magazine about single payer.
Yes, this is a pull-out about single payer that we put. So in our magazine, even though we wonder when people read or not, but this is like a centerfold we pulled out, like our Playboy centerfold is our single payer. This is in our magazine, so feel free to take these and spread them around as well.
Okay, we're going to have 5 more minutes with questions.
We
go
to 4?
That's what it says on the.
No, it does, no, 2:45.
3:45.
3:45.
5, we're gonna have
we have
2 more
time for
questions,
questions,
and then we're gonna put in the video. Okay, sir?
So people can see the video for you.
In the
I have
bridge.
some.
Oh,
Go,
we'll do what we can.
No, go ahead.
Let me see if I can lay this out. Okay. From my perspective, as somebody who's worked in clinics, as a social worker and so forth, and as a patient and so forth. As we all know, there's been an effort to cut costs by delegating tasks from doctors to, let's see, what's the list? Nurse practitioners, PAs, medical assistants, and receptionists. I don't know if you've heard the expression that used to be used, de-skilling.
De-skilling, yeah.
Okay.
They're doing it.
My perception is that there are doctors who fight this, and then there are doctors who implement it using a corporatist model, and whose offices resemble assembly lines. Has everybody had that experience of being in an eye doctor's office, and it's like cubicles, it's like you feel like you're on an assembly line. My question is, does anything like that exist in a country like Cuba, or we could start with Cuba, and if so, what does it look like? Because I'm sure it's not based on a corporatist capitalist model. So, I mean, are there medical assistants in Cuba? I would be surprised if there were, as opposed to nurses and whatever. But anyway, I'm just very curious.
I want to defend our nurse practitioners.
I'm not criticizing. I see a nurse
but they don't have nurse
practitioner.
practitioners in Cuba because medical school is free. Nurse practitioners became nurse practitioners because medical school was really expensive and they weren't wanting to do primary care. And also nurses had a lot to offer, and also our system is not holistic. So the holism of being a nurse and the need for primary care providers, which nurse practitioner, I'm a nurse practitioner, although as a blacklisted one, I'm working as a staff nurse. But anyway, the goal, so it's a little different. But in terms of de-skilling, of course, that's something that we see there. Over in Cuba, what's really interesting about the Cuban healthcare system, as you know, as a practitioner, we have prevention, treatment, and rehabilitation, right? There they have the number one thing is called attention. You know, and we went to the Ministry of Health, he spoke about that. He said, well, the first, and we also said prevention. He said, no, it's attention. They spend hours the first time they see a patient. The way the system is organized in the terms of the primarios, the primary care, they take a population of 250 families, which are known to the primary care center very well. Like when we went there, we said, how many patients do you have who are pregnant? 9. And how many? 27. And how? 14. You know, they know everything about everybody, and they get that attention. So because people are known, if they have a more complicated issue, and then there's a whole triaging of where they go, they resolve most issues initially. What's going on in your home? What's going on in your neighborhood? Can you grow this kind of tea leaf? To, you know, everything. And then when people have more complex issues that aren't dealt with in the primary care, then they go to the polyclinic. If it's really serious, they go to the tertiary center, the technical hospital. So,
I mean, is there any of that chain, like where people will see a nurse before, or PA before the other PAs in Cuba?
No, there's no nurse practitioners, there's no PAs, there's nurses at various levels. And the nurse and the doctor play very
So will they
complementary
have somebody
roles.
see a nurse before they see a doctor, or not?
You always, there's 2 doctors in each primary care, and they focus on
That in
basic.
itself is going to create better healthcare, because I don't know if other people have had this experience. With myself, who I argue with, but I've had clients, they'll call a doctor's office with a medical problem, and the receptionist decides that they can't see them for 2 weeks.
Yeah.
I mean,
The
what
doctors
kind of
go to
madness
people's
is
homes.
that?
They have a year
It should
responsibility.
be a medical person deciding that they can wait 2 weeks, not the receptionist looking at the computer and seeing there's no slots open.
Each doctor has a year responsibility where they are 24 hours, 7 day a week, 365 days on call in that community. That's for just 1 year. That's part of the process. And then there's other consulting physicians, so that there's constant access. Plus neighbors look out for each other.
I think this stuff has to be gotten out there
Yeah.
to people, because
It's extraordinary.
people are getting angry at feeling like they're an object on an assembly line.
That's not what
And
happens.
we got to tap into that
They don't
anger
have to
by
be.
telling them how it is in a country where
Where there's a trade-in burger.
What's interesting is they told us they'd never had ADHD before, but now with the proliferation of these devices, they're seeing, they're trying to determine is this, they're seeing this kind of.
The other thing I'd like to bring
ADHD.
up, which is very close to home, I don't know how many people know, well, HIPAA. Okay, is there anything, okay, I'm married to a Hispanic, and when I tell her stories here about where people won't talk to families in the United States without the patient's permission. She thinks we're stark raving nuts. What do you mean you won't tell a parent that their child's in a hospital? You go to, probably, my wife's from Nicaragua, you go to a country like that and you tell a parent that we're not going to tell you, they'll probably take out a machete. You know, what do you mean you're not going to tell me where my daughter is in the hospital? But we do this with this HIPAA stuff, which I know it has a place, but it is, I believe, abused. It is abused by healthcare workers to get out of doing the work of networking and connecting with families. It just becomes a quick and easy way to just focus on the individual, even though, as you know, in Cuba, they're meshed in a family system. The family system is the most likely ones to, and I'm not talking about abusive families. The family system is the one that's going to be there for the rest of their lives, hopefully, and have to deal with the elderly, the disability, whatever, and they won't talk to the family.
Is that a question?
Well, I guess, does that happen in Cuba? Anything like that happen?
They have confidentiality, but
not to the
everyone
levels.
knows everything.
Yeah, it's not like
They know
that's
stuff.
capitalism.
There's a law that says you can't talk to families, but they all.
No, it's not a law,
No, it's
but
not a
no.
law.
But I think you use your discretion as to how much, because I mean that HIPAA law has its place, like you said, in order to elicit information from a patient. Sometimes you don't get that information if mom or dad is sitting there. So HIPAA does have a place somewhere. Cuba has a way of dealing with that, but it's not as stringent as it is here.
So they
Parents have to be involved.
They will get
Parents
a
are
written
involved with care.
release to talk to a family member.
I don't think you need a release.
It's not that
It's
bureaucratic. It's not that
No,
bureaucratic.
in fact, I think it's illegal not to under certain
Yeah.
circumstances. If there's young people with issues, the family's involved. It wasn't like a question.
Yeah.
Like
But
if you have young pregnant women, the families know.
Right.
And birth control issues are discussed.
I mean, there's a
Abortion.
whole cultural difference.
Yes, culture, yeah.
That reinforces
And that's the
it.
main thing, the
Unless
culture.
there's an abuse case, but
Right.
yeah.
But their families are much more intertwined.
Yeah.
So
And people all
everybody-
live in the housing issue is big, so
Yeah.
you have 3 generations living in the same house. Everyone's gonna know everything.
It's more like
Does
community.
everybody know
It takes a
what-
village. It's more of a village
Do
concept.
people have
Like
these
feedback,
you can call a hospital and they won't tell you if your loved one is in the hospital.
Correct.
It doesn't happen in Cuba like that.
But typically when patients go to the hospital, they've gone through so many different steps before they actually get to the hospital system that the family typically knows that they are going to the hospital, have gone to the hospital.
Right.
They have their primary care physician, then they go to the polyclinic, then they go to the hospital. So there's so many steps that the family will be aware of before they even get to the hospital. There's not really a question of, unless they're in a catastrophic accident, by which they would be reaching out to the family
Here-
anyway.